Okay, so today I'm going to show 3 adjustments that are very commonly done when someone has shoulder pain. And again, this is after full assessment. We know exactly, based on diagnostic ultrasound and based on x-rays and based on history, exactly what's going on with the patient. But I'll show you how gentle and how rather simple these adjustments can be. So the first condition is an impingement syndrome. That is something that happens between the ball and the socket. A lot of people will feel that in the front of the shoulder. And so the way that we address that, and the most common misalignment in this case is where that ball has slid forward and the patient has this anterior presentation with their shoulders. So what we do is, I'm going to borrow this, I'm going to rotate, I'm going to bend this elbow, I'm going to cup this elbow, and I'm going to brace his scapula from behind, and then very gently we're going to bring it down and then slightly back and up right there. And then that allows us to realign that ball and socket so that that comfort is reestablished and that range of motion is reestablished. So that's that adjustment. The second one we're going to do is called the acromioclavicular adjustment. There's a joint, it's called your AC joint, and it attaches your clavicle with a portion of your scapula. So I'm going to lay you on your back. And again, this patient has been fully diagnosed. What we do is we bring this arm back and then we make a contact right at that AC joint, and then light traction of the shoulder, and then it's just a simple thrust, and then relax. And that helps to realign that AC joint. Again, comfortably allowing for that range of motion to be reestablished and allowing that joint to be more natural. The third adjustment is an adjustment that allows us to work with the sternoclavicular. And so that is where the clavicle and the sternum connect. A lot of people can almost feel like there's chest pain in the front of their chest. Again, you want to rule out all causes of chest pain, but in this circumstance, it's a clavicular joint that is the sternoclavicular joint that is compressed. So the way that we adjust this is that sternoclavicular joint is right here. We make a very specific contact, and then it is just there, and that's it, and it drops right into place, and then that patient has this instant feeling of comfort back, that pressure is removed, and that person is going to feel that benefit right away. So those are 3 very common, very simple adjustments that we see in the office. Again, let's get that properly analyzed and diagnosed so we can determine exactly what is the best work that's needed to be done for you to get your shoulders feeling great again. Thanks for joining us.